So myopia, the best way to say it is short-sightedness. So that's like for a child, it's when the vision in the distance is blurry, so that they can still see okay at near, but over time it gets blurrier and blurrier to see things in the distance. And this is because the eye normally does grow as the child grows, but myopia is when the growth exceeds normal growth, and so the eye grows too long. And so when the eye focuses the image, the lens focuses the image, the focal point is in front of the retina, and therefore the patient cannot see the distance vision. And corrective lenses like glasses and contact lenses basically refocus the light at the retina that's now a bit further back. The rates are really increasing globally. They're saying 50% or more of children will all have myopia. And there's a combination. There's genetics. My parents both had myopia. So, I developed myopia. Also, screen use, like nowadays, we've got iPads, TVs, iPhones, a lot of near work for children from a young age, and also less time outdoors. So, because of the competition in school, children are going to tutoring, they're, not going outdoors as much as when in the past when there was a lot of sporting activities and being outside all the time. These are all contributing factors to myopia, for the incidence of myopia as well as progression of myopia.
So when you say the growth or the elongation of the eyeball,
Mm.
you're saying like from front to back, from the front or the cornea, that part of your eye to the rear, it actually is becoming
Correct.
more elongated as the
Mhm.
child's eyeball grows, right?
Correct, yes.
Okay. So what age would children sort of start to see myopia affecting their vision?
So normally it starts around school age. So I'd say between 6 and 10. It's good because it's an age where the child can verbalize, mom, dad, I really think that thing in the distance doesn't look very clear. And it is so important at that point in time to bring them in for assessment to check to see if they have myopia. I've also got kids who've, presented a lot earlier. So I've had the youngest child I've had with myopia is probably around 2 years old, and I can start management at that age because I know how to do cycloplegic refraction. So the child will not even need to talk to me for me to know what their power is and to start treatment. And so I feel like it's, that's obviously rare. Most of the time it is in a, school cohort, but, it's getting younger and younger. I'm seeing younger kids with myopia, and the younger that they present, the more likely they're going to get higher degrees of myopia and it's going to progress faster. So it's imperative in those populations that they get treatment as soon as possible and be regularly monitored and assessed.